So we start with an example. We were actually doing a survey of back pain in ophthalmology amongst the ophthalmologists, and we wanted to study the prevalence of back pain amongst the ophthalmologists in India. So what would be the ideal data in this case? It's probably taking up a questionnaire, which is filled by each ophthalmologist in the country. That would be the ideal scenario. But what would be the difficulty? It will be difficult in contacting each and every single ophthalmologist. The time duration taken for the study will be very huge, and there is a lot of manpower and money wastage. So what we want is that in a pool of all doctors, we take a sample of those doctors, we send the questionnaires to those sample of doctors, study our hypothesis, analyze them, and then come up with the conclusions based on that particular sample. So a wrong sample size, which it will eventually have scientific consequences because you will not have the right kind of results. It will have ethical consequences because your results will eventually modify the clinical practices, and economical consequences because you may end up redoing this entire study if your sample size is not right. So with this background, we will just talk about how easy it can be, how easy and it is important to understand the concept of sample size calculation. So the basic difference between a population and a sample is a population is a complete set of elements that possesses some common characteristics which are defined by the sampling criteria which is established by the researcher. Whereas a sample is a selected elements chosen for participation in a study. People are referred to as subjects or participants. So one must understand this basic concept in sample sizes. That is, if you reduce the errors in your study, you need, if you want a less number of errors, you need more people or more number of samples to be studied. So sample size is inversely proportional to the difference or the effect size. It is inversely proportional to the alpha error, and it is inversely proportional to the beta error. So what do you mean by the margin of error or the effect size? The margin of error is basically the difference between a sample mean and a population mean. So more the difference or more the margin of error, the less is the sample size you need. So margin of error is actually inversely proportional to the sample size, and therefore sample size is inversely proportional to the square of margin of error. So what we see in this graph is that less the margin of error, you need a higher sample size, and as the margin of error increases to almost 10%, the sample size keeps on reducing. So the other important terminologies which needs to be understood in this is the alpha error, the beta error, and the power of the study. So I just wanted to study, so this is an example where we say that we wanted to study if back pain has any relationship in the reduction of work hours amongst the ophthalmologists. So basically the hypothesis will be, the null hypothesis is that there is no relationship between back pain and loss of work hours, and the alternative hypothesis is that there exists a relationship between back pain and loss of work hours. So what do you mean by alpha error? Is that the alpha error is that when the null hypothesis, the true nature of the hypothesis is actually true, but the conclusion drawn is that there is a rejection of the null hypothesis. So that is what is known as the alpha error. So it is also a false positive error, and you keep it at a very minimal amount, that is usually at around 5%, and depending upon the study you can reduce it to 1% as well. Whereas what is a beta error? That means when the null hypothesis is false, but there are some error in the study which actually accepts your null hypothesis. So that is known as the beta error. So when the alpha error is when the null hypothesis is true and it is rejected. So, and the beta error is when the null hypothesis is false but it is erroneously failed to be rejected or it is accepted. Now the power of the study is 1 minus the beta error. So if you have a power of a study of 20, if you have a beta error of 20%, so the power of the study which is calculated is around 80%, and if you have a beta error of 5%, the power of the study is subsequently to be 95%. So for studies to be relevant, the errors, they need to be very minimal. So less the alpha error, more sample size you require. Similarly, more the power of the study, you need more sample size, or less the beta error, you need a more sample size. So the basic formula which is required for sample size calculation is understanding that it is the margin of error, the alpha error and the beta error which needs to be known in deciding the sample size calculation. This Z alpha by 2, it is actually the critical value which is already been prefixed for a particular level of alpha error So if you have a 0.05 alpha error, your Z alpha becomes 1.96, 0.01 it is 2.57, and if it is 0.001 it is 3.29. So this is an example where you look at the first column where there is a standard deviation of 3.5, where the sample mean and the population mean is 14 and 17 respectively. You have an alpha error of 5%, you have a beta error of 20%. Okay, and it's a two-sided test, and so the sample size which is calculated is around 11. So this is an online calculator which actually calculates the sample size for you. But what's important is to see is that as the standard deviation is increased, the sample size increases. So in the third column, what you see is that as the alpha error is reduced, the sample size is increased. Then in the fourth column, you see is that as the beta error is reduced, the sample size is reduced, and fifthly, you see that as the effect size is reduced, or if the difference is reduced, the sample size is increased. But the sample size also depends upon what type of study you do, whether you have a single sample study or a double sample study, and whether what variable are you trying to understand, whether it's a study of means or it's a study of proportion. So when you have a formula for two samples, so what you need, the basic formula still remains the same. What you need to do is you need to create a ratio of R plus 1 by R, where R is the ratio of the larger group divided by the smaller group. So we created a 4-step approach to calculate the sample size. What it's needed is you understand the studies design, how many groups are there in your study. Is there a difference? Is it a difference in means or difference in proportion? What is the alpha error and what is the power of the study or the beta error? So look at this study where it's a randomized control trial which has been planned to evaluate the rise in the blood pressure following installation of topical epinephrine eye drops in comparison to usual treatment. The blood pressure measurements were done 1 hour after the cataract surgery, and the standard deviation for this measurement was 7.7, and the difference of 5 millimeters was considered to be clinically relevant. So in this study, so it was a randomized control trial, so you had two groups, one is a cases and a control. This was a difference in means. The standard deviation is already mentioned, which is about 7.7. The effect size or the difference is 5. And assuming that it's a 95% confidence level on an alpha error of 5% and a beta error of 20%, this is how you just put these values in the formula and you will get the sample size. Now this is again a case control study where where the linkage of wet AMD with smoking cigarettes, and they wanted to see what are the proportion of patients who develop wet AMD following smoking, where they accepted a 10% difference. So this type of study is a difference in the proportion study, where you're trying to look at percentages of people who develop who were smoking developed wet AMD. So which variables should be included in sample size calculation? The sample size calculation should relate to mainly to the primary outcome variable. So you look at the primary outcome variable, and then that is what is the most important thing. If the study has got multiple outcomes, so you have a primary outcome and multiple secondary outcomes, the sample size should be calculated in such a way that it is sufficient for analysis for the secondary outcomes as well. And separate sample size calculation should be done for each variable, and then you take the maximum estimate. The sample size calculation should relate to the final achieved sample, and the sample sizes, they should also be corrected for expected low response rate, loss to follow-up, and lack of compliance. So you have these sample size adjustments where you expect a certain percentage of patients to be lost to follow-up. So this is a study where you have actually you expect, this is a sample size which was calculated of 37, and there was almost 1/3 of the patients were lost to follow-up. So the corrected sample size will be much more because you already expected a 33% loss of follow-up. So to summarize, the sample size calculation depends on alpha error, beta error, and the effect size. It also depends on the type of the study and the dropouts from the study as well. Thank you so much.